Welcome to Up Close and Personal, the show that gives an up-close and personal view of the people, places, and events in Nashville that make a difference in our lives and our community. Here's your host, Jennifer Gamble. Welcome to Up Close and Personal. I'm Jennifer Gamble. Planned Parenthood is a nonprofit organization that's recognized as a national leader in providing reproductive health care, preventive health services, and sex education to men, women, and teens. While most people are aware of the controversial contraception and abortion programs that Planned Parenthood offers, other life-saving health services provided, including cancer screening, HIV screening, and counseling, receive little attention. Today on Up Close and Personal, we will visit Planned Parenthood of Middle and East Tennessee to learn more about the all-important programs and services that Planned Parenthood provides for everyone's well-being and improved quality of life in our community. Welcome to Up Close and Personal. I'm Jennifer Gamble, and I'm here at Planned Parenthood of Middle and East Tennessee with President and CEO Jeff Teague. Thank you for joining me today.
It's my pleasure. I'm glad to be here.
Now, most people have heard of Planned Parenthood. You all have been around for many years, and more recently, the 2012 presidential campaign certainly put the spotlight on some of your more controversial programs. Tell us about the health programs. Most people don't know that Planned Parenthood does so much more for women's health. Tell us about your health program.
Absolutely. I think probably one of the best places to start is really to talk about what the values of Planned Parenthood are. And in our values statement, two of our most important values that we hold very dear to us is the belief that reproductive self-determination, the right for people to determine for themselves about their reproductive lives, is a basic human right. We believe that women, families, should be able to decide for themselves whether or not they're going to have children, the number of children that they'll have, the number of those children, the timing, the spacing, under what circumstances they will and won't have children. We believe that's just a basic human right. And the next thing that we believe very strongly is that everyone should be able to exercise their sexuality openly, freely, without fear, shame, intimidation, and coercion. So I think that's the basis of who we are and what we do. And to carry out those values, we have a mission of providing reproductive and sexual health care to people regardless of any circumstance. We care no matter what. Right. We provide educational programming to equip young people, parents with the skills and the tools they need to be able to have informed conversations, make healthy decisions about their reproductive lives, about their relationships. Right. And then, of course, when we advocate really strongly for policies that support those first two things. But back to your original question about what are the healthcare services that we provide, I think one of the things that people don't realize is that the vast majority of what we do are preventive services. 97% of what Planned Parenthood does is preventive services, things like life-saving cancer screenings, providing affordable birth control, breast exams, testing and treatment of sexually transmitted infections, testing and referral for HIV, that whole range of reproductive and sexual health care services.
So important for everyone's well-being.
Absolutely.
And particularly important during these economic times. Have you all seen a rise in the number of clients or patients that you're seeing?
We have. Beginning in 2008, when the economy really began to go into the downturn, it's when we saw a huge increase in the number of patients turning to us for affordable health care services. One of the things that's I think it's something that people don't realize is that about half of the counties in Tennessee, at least 25% of the women and children in those counties live in poverty. Wow. And we believe that there's a very strong connection between inability to access affordable health care services, particularly reproductive health care services, and poverty. Mm-hmm. We believe really strongly that one of the things that we have to do is empower women and empower them to take control of their reproductive lives, because until they can control their reproductive lives, They can't get an education, they can't provide that for themselves, and they can't provide for their families. So we really feel like that a lot of the work that we do is not only creating healthier women, men, teens, families, but also doing what we can to break a cycle of poverty that traps so many people in desperate situations across Tennessee and across the country.
Now, how will the new legislation, Obamacare, impact your services?
Absolutely. We're very excited about that. The most important thing is that 35 million Americans who haven't had access to any form of health insurance are suddenly going to have access to health care, which is incredible. Yeah. We're particularly excited about the options related to women's health care.
The Patient Protection and Affordable Care Act, more commonly known as Obamacare, is a United States federal statute signed into law by President Barack Obama on March 23, 2010. Together with the Healthcare and Education Reconciliation Act, Obamacare represents the most significant regulatory overhaul of the U.S. healthcare system since the passage of Medicare and Medicaid in 1965. Obamacare is aimed at decreasing the number of uninsured Americans and reducing the overall cost of health care. Specifically, Obamacare benefits women by ensuring that women get equal health care rights and improved access to women's preventive health services, including well woman visits, gestational diabetes screening, domestic and interpersonal violence screening and counseling, FDA-approved contraceptive methods and education, breastfeeding support, supplies and counseling, human papillomavirus or HPV testing, counseling for sexually transmitted infections, and HIV screening and counseling. Studies suggest that over half the women in the United States have avoided or delayed preventive care due to cost. The results of health service not being available to all women has had a great effect on pregnancy, STDs, and a number of other health-related issues.
Absolutely. We're very excited about that. The most important thing is that 35 million Americans who haven't had access to any form of health insurance are suddenly going to have access to health care, which is incredible. Yeah. We're particularly excited about the options related to women's health care. All the preventive services that we provide and that will be provided to women, those cancer screenings, Pap tests, breast exams, those sorts of things, are all going to be services that women are going to be able to access with no copay, which is going to be great. It's going to increase access and keep the costs down for women. There's also, for most contraceptive options, there's not going to be a copay for those as well. So again, a great way for women to finally have access to health care that they haven't been able to afford in the past and still be able to access it without any additional cost to them. So it's really, really very exciting. We are anticipating that we're going to see an increase in client numbers. It's a concern because there's not enough healthcare providers in the country, let alone in Tennessee, and especially in some of the rural, poor parts of Tennessee, counties across the state. So we're really excited that women are finally going to be able to have access to these services.
And working behind the scenes on how to work out.
Absolutely, we're working to make sure that we have all of the technology in place to be able to help access that, and make sure that we have all the contracts in place with the appropriate health insurance agencies and providers to make sure that women can access the programs that they need so desperately.
Now, and most people recognize Planned Parenthood as a leader, a respected leader in providing that reproductive health and sexual education for women, men, and teens.
Absolutely.
Which again is particularly important in today's society with the increasing and alarming numbers of teens with sexually transmitted diseases. What kind of programs do you have geared specifically towards teens to educate them about their sexual health?
Well, we have a comprehensive sexuality education programming provided in communities all around Tennessee. We have incredibly well-trained educators who go out into any setting, whether we're invited into schools, We get invited into churches for youth groups, into youth programs, basically any setting that we can go and speak to young people about their sexual health and decision making, what are healthy relationships. We talk to them about a whole variety of issues. The one thing that we do stress in all of our programming is abstinence, but that is not all that we talk about, because we do understand that young people do choose to become sexually active, and when they make those decisions to do that, we want to make sure that they have the information they need to protect themselves, the skills and the tools to make healthy decisions, not only about whatever sexual activity they're going to be involved in, but the relationships that they're in. We want to make sure that they feel empowered, if that's the case, to not be coerced or forced into situations that they're uncomfortable with. So we do that through a variety of things. We do it in classroom settings. We do it at church youth groups, which is always great. And we do it with peer education groups. Our PG-13 Players has been around for nearly 30 years in Middle Tennessee.
Now what is that, the PG-13 Players?
It's a group of local high school students. It's a group of about 20 high school students from local high schools across Nashville who come to us and they go through intensive training. They get educated on all aspects of sexuality and sexual health. They get educated on all means of birth control, of all the services and programming we provide. And then they're a teen theater group, so they actually write skits themselves. They decide what topics they think are relevant and important to their peers. They write skits on those topics, and they perform them in those different settings that I talked about, the schools, youth groups, wherever we can get invited. And they leave the resolution of the skit open, because then it encourages a dialogue and discussion. So it brings the audience, it's very interactive and participatory, where audience members get to ask the characters, they stay in character the whole time, ask the characters questions about the skit that they've just performed and the situation that they presented. So it's a wonderful way to engage the audience and not just stand and just present stuff, but allow them to interact and ask questions. We're also very lucky that those community educators that we have not only train and speak to young people, but also talk to parents.
Oh, wow.
Which is really great, because it's shocking to realize how little parents know about sex and sexuality. And you know,
you
it's
want to be prepared.
absolutely.
To answer those questions
And
when the kids come to
so we give them again information and the tools that they need to talk openly and easily with their teens, with young people in their lives about sex and sexuality. That's one thing that we really stress is parental involvement, making sure, whether it's in our health services or in educational opportunities, to make sure that parents are really involved in that, because that is the most critical and important relationship. We think that's really important. Another thing that we do with our community education programs is we train other professionals who work with young people as well. So through something we call the Sexual Education Training Series, or SETS, we have a multi-day program where people who work in other organizations that interact with teens on a daily basis come to us to get training again on how to talk to teens about decision making, healthy relationships, and providing them again the skills, the tools, the information they need to have informed conversations with young people.
Well, this is great for the young people. Studies show that education is the best defense against sexually transmitted diseases and other family teen pregnancy and
Absolutely.
other issues affecting our young people. So this is a great way for them to get the information they need to be prepared to make better decisions for their lives. So that is wonderful.
We think it's particularly important now that some unfriendly legislation has been passed that's made it really difficult to provide in schools the kind of comprehensive sexual health education that young people need. They've created situations where it's only abstinence-based, which is great. We, as I said,
show that doesn't work.
But
only abstinence, teaching only abstinence doesn't
is exactly. Exactly. So it's something that we're concerned about. What's going to be happening to this next generation of young people when all they're getting is abstinence, and they have so few opportunities to really get the full comprehensive range of information that they need to protect themselves and to protect their health and make healthy decisions.
Right. Is there a myth or a misperception about Planned Parenthood that you would like to dispel?
I think, yeah, absolutely. I think so many people think that all we do is provide abortion services. We do provide abortion services. We do that, and we're proud that we're able to provide a quality service to people, women who come to us in need.
And women have fought, and legislators and leaders have fought for that right for many years, and it is a law that is allowable in this country.
Absolutely. Absolutely. So I think, though, that a lot of people believe that that's all that we do. I referenced earlier that the vast majority of what we do nationally is preventive work. About 97% of the work that Planned Parenthood does nationally is preventive health care. Yes, we do provide abortion services, but the vast majority is access to cancer screenings, life-saving cancer screenings, access to affordable birth control and other forms of contraception, testing and treatment of sexually transmitted infections, breast exams. Women, young people, men turn to us for a whole variety of reasons. I think another thing that's sort of interesting is that people don't realize that men actually come to Planned Parenthood, that they think that Planned Parenthood is just solely a women's health care provider. That is the vast majority of who do come to us, but we do have men who come to us for cancer screenings, for testicular and prostate cancer. A lot of the men that come to us are obviously coming for testing and treatment for sexually transmitted infections. They come because their partner came, and they come together as a couple to make sure that they have good sexual health.
Well, this is wonderful. You all do great work in our community, and I commend
you so much.
Planned Parenthood for your commitment to taking care of promoting the well-being of everyone.
Well, that's absolutely, and thank you so much. We really appreciate the opportunity to talk with you and help people understand a little bit more about Planned Parenthood.
Well, thank you.
Absolutely.
Now, Jeff mentioned the PG-13 players, and we're excited to visit them and kind of see what they do. Tell us who you are and what you do here at Planned Parenthood.
So my name's Lindsay Godwin. I'm the Manager of Education and Training here at Planned Parenthood. And the PG-13 players are one of our peer education groups. So we do a lot of different types of education in the community. We do stuff specifically with community-based organizations like the Oasis Center or Nashville Cares. We do professional training, we do parent training, and then we have our peer education program. So I'm excited you'll get to see these teens and the work that they do.
Now, how do you recruit the students who are involved? Do they come to you? Do you all go out and seek them?
It's sort of a combination. We, every spring, do an audition process, and through our community partners, let folks know that that's happening. And so then teens will call up Elizabeth Bradner, our peer education coordinator, our youth coordinator, and schedule an audition. So they come in and they do sort of a minute monologue piece, and they do a few questions with her. And then there's a second callback process where they work with the whole group. So they work with the players who are here currently. And they do, it's mostly a low-key thing. It's a lot of group building games and theater games just to see how everybody interacts. And then they do some small group questions just to have some conversations about the things that they think are most pressing for teens right now. So generally questions around, what questions do you hear your peers ask around sex and sexuality? What misconceptions are out there? What do you think is most important? And then from there, they do a summer training, 2 weeks of intensive training so that they can be good resources for their communities. It's just a really interesting process.
Sounds great. Well, we're excited to see the team in action,
yes.
The group in action. If someone were interested in joining or finding out more information about PG-13 Would they need to go on your website, call? What do they need to do?
Either will work. To schedule a performance or to find out more about auditions, they'd want to call Elizabeth Bradner directly. Okay. You can just call our general number at 615-345-0952 and ask for Elizabeth, and she can give information about the program. She can get folks signed up for auditions in the spring, whatever it is. Any questions about the program, she'd be happy to answer.
Well, thank you so much. Let's go see
Awesome.
in action.
Yes, let's do it.
Thanks.
Hey Michael, what's up? So, how was your day today, babe? You failed your pop quiz? I'm sorry, that must really suck. Are you still gonna come watch me cheer tonight? If not, I understand. We can always meet up afterwards. Well, my parents are out of town, remember? Well, I'll talk to you later. Bye.
Hey, heard your whole combo. What's going on?
Nothing. Just talking to my boyfriend.
Oh, what about?
Sex.
What do you mean sex?
Well, me and Michael have been thinking about doing it lately.
Oh, well, y'all been together for a while, right? What's the problem?
Well, he's just not taking the initiative, so I'm taking matters into my own hands.
Oh, so he's one of those guys.
What do you mean one of those guys?
One of those wait till marriage types.
I don't think so. We do other things.
Well, then I don't know what his problem is, but if he isn't comfortable, you shouldn't pressure him.
Why wouldn't he be comfortable with it?
I don't know, but it's one of those things where if he says no, he means no.
He hasn't said no.
Well, it seems to me like he's just not that into it.
Are you trying to tell me that my boyfriend's not into me? Not into this?
No, dude, just calm down.
Alright, whatever.
Hey, what's going on?
Well, I'm just really confused. Like, Andre's just been really touchy-feely lately, and I'm not so sure if I'm ready for what he wants.
Well, have you talked to him about it?
Well, yeah, but I honestly think he's gonna break up with me if I don't do what he wants.
Why wouldn't you want to do it? He's hot.
Well, yeah, he's captain of the basketball team, but looks aren't everything.
Exactly. He's captain of the basketball team. Everybody wants him.
Being captain of the basketball team has nothing to do with it.
I just feel like I'm being taken control of.
Dude, just do it. What's holding you back?
I'm just not ready to have sex.
Well,
Just talk to him.
Alright.
we're teenagers. It's what we do.
Hey, what's up?
Nothing. I'm so excited for tonight.
Why?
Because tonight's the night.
What do you mean by the night?
Me and Michael are finally going to do it.
Does he know that?
What do you mean does he know that?
Well, I heard from Charlie that Michael's not so ready to have sex.
Well, trust me and Michael are doing it. He loves me.
Just because he doesn't want to have sex with you doesn't mean he doesn't love you.
Well, just because you're afraid to have sex doesn't mean other people shouldn't.
I'm not afraid. I'm just not ready.
Well, whatever. Stay out of my business and I'll stay out of yours.
Whatever.
Hey,
What have you been telling people about my boyfriend?
what are you talking about?
I heard you tell that little prude.
Hold up, prude. Are you talking about Jordan?
Yeah, Jordan, whatever. I heard you tell people that my boyfriend doesn't want to have sex with me.
Because he doesn't. I talked to him and he doesn't want to have sex.
I think if my boyfriend didn't want to have sex with me, he'd tell me about it.
Well, you're practically trying to rape him.
What makes you think that?
Because you've been pressuring him to have sex forever.
Dude, whatever.
Just talk to him.
Hey, Charlie.
Hey, what do you want to talk about?
Well, I'm going to see Andre tonight.
Okay.
I really think he's going to try something.
Are you okay with that?
Honestly, no. I mean, I love him. I'm just not ready for what he wants.
Well, maybe you shouldn't go.
Well, I thought about that. It was an option, but I really do want to see him, you know?
Well, it's your decision, but I think you should just play it safe and just not go.
I don't know. I'll think about something later. I'll just talk to you later.
Okay, just let me know.
I will.
Hey Jordan, can we talk?
What could you possibly want to talk about?
I just wanted to apologize for the other day. I stepped out of line and you were just trying to help me.
It's okay.
Well, I wanted to let you know that me and Michael decided to wait.
Well, I'm so glad things worked out for you.
Hey, Jordan.
Hey.
Oh, hey.
Hey,
What's going on?
Nothing. I was just telling Jordan about how me and Michael decided to leave.
Oh, okay. So, Jordan, what did you want to talk to me about?
Yeah, is everything okay?
Well, I saw Andre last night.
How'd it go?
Did you guys talk?
Nah, there was no talking.
What do you mean?
Well, there was some talking, but Andre just didn't want to listen.
What do you mean he didn't want to listen?
We did it.
I thought you didn't want to.
I didn't. I mean, he was just pressuring me the whole time, and I couldn't say no, and I mean, I was enjoying it, but I didn't want it.
So, did he force you?
No, it wasn't forced. I just felt manipulated.
Well, how did he do it?
He made me feel bad about our relationship.
Well, what are you gonna do?
I don't know. I mean, I still love him, but I don't know what I'm gonna do.
So the group we just saw are the PG-13 players. They're a group of 9 teams from across Middle Tennessee. They're all high schoolers, and they audition to become a part of the group. In addition, they write these skits. The one that we just saw was their sexual decision-making skit for this year. They change every year. And what we do is we take these into churches, synagogues, places of worship, after-school programs, whomever invites us in, and we perform for them. And then we stay in character. As you notice, there isn't a resolution to the skit. It kind of stops at a pretty critical point for one of the characters. She's trying to decide what just happened, what she needs to do. And they stay in character and open up a Q&A session to the audience, where the audience then is invited to ask questions of the characters. Why did you make that decision? What are you going to do now? Why didn't you do this? And hopefully that starts some gears turning into their heads as far as maybe what their own personal risk is, or maybe they've seen that happen and now they have some resources, some ideas about what to do, what other decisions are out there, what are other options for them, and even how to be safe in these decisions that they're making.
Now, how long have you been a PG-13 player, and what made you become a participant of the group?
This is my second year being a player, and I've seen performances from PG-13 players since I was in 8th grade, and I've always thought it was really inspirational and cool, and all the stuff that they learned was like really, really interesting to me, so I wanted to join, and I joined my junior year of high school.
That's great. Now, how has the program prepared you for real-life decision-making?
It's taught me so many different things that I never would have learned, like in my sex ed class or my wellness class, and it's really, really helpful because I could teach these things to my children, my grandchildren, and also so on.
I hope you have enjoyed today's show. I'd like to thank Planned Parenthood and the PG-13 players for allowing me to give you an up-close and personal view of what they do to promote women's health and inspire healthy attitudes. For more information about Planned Parenthood, call 615-345-0952 or visit their website at www.plannedparenthood.org. Thanks for watching. Tune in next time for more Up Close and Personal.